I'm a child and adolescent psychiatrist and the medical co-director of the Eating Disorders Program at McMaster Children's Hospital. I'm also an associate professor at McMaster University in psychiatry.
Okay. So first off, can you tell me a little bit about the funding that you received?
Yeah, so we have just received a grant from the Canadian Institutes of Health Research, otherwise known as CIHR, and the grant will allow us to study the impact of the COVID pandemic on young people with eating disorders. And there's a second part to the study. It is to develop parent peer support groups for parents of young people with eating disorders across the country.
What are those support groups and why are they needed?
Great question. So our mainstay of treatment when we're talking about adolescents with anorexia or bulimia is called family-based treatment. And this is where the parents are placed in charge of helping their young person to eat or interrupt eating disorder behaviors. And it's very stressful for parents. Even outside of the stress of having a young person with an eating disorder, which is stressful in itself, but the treatment is also extra stressful for parents, and they really need the support of others who have been through the process before. It's very, very helpful to them. We know this because we've been running and studying a parent peer support group already in Ontario. The results aren't out yet, but from what I can tell you, it's very, very beneficial. And this next grant will allow us to expand the groups across Canada and study them in Hamilton, but also Calgary and Halifax. So we're very excited about it.
So I just want to make sure I understand. So it's a group of parents that you're going to be studying, or it's the support group and, you know, how they can help their child? Or could you sort of go a little bit more into detail about that?
Sure. What we're really interested in is how parent peer support works. So there's not going to be clinicians present. It is parents who have been through the process themselves of family-based treatment, or they've had a young person recover from an eating disorder, and the parent facilitator will help the other parents. They provide a lot of hope. They reduce isolation that those parents might feel. They help them navigate the system, which is a huge challenge in itself. So we're studying what are those elements. We have theories about those characteristics that we think are helpful, but we want to study it in more depth. So we're going to collect interviews with those parents after they've been through the group, and we're collecting some other measures, and we're seeing how the facilitators feel about running the groups as well.
What are some of the things to look out for as a parent if you suspect your child has an eating disorder?
Yes, that's a really great question. So parents, I think they really know their child the best, and they have a sense when things aren't right. And a few red flags that parents can be looking out for are social isolation. So that's really prominent right now in the pandemic, that adolescents aren't able to see their friends. But if they're also withdrawing from the family, that's a red flag for me, because they're in their bedroom, they're alone, maybe exercising or thinking about body image. If they're talking a lot about body image or wanting to lose weight, that might be a red flag. If they start to lose weight and it's not in their best interest, that's another red flag. Any change in dietary patterns that are extreme, any purging, of course, is a definite red flag. and parents should be trying to get to their family doctor somehow. I know it's really difficult right now, especially with the Omicron variant now circulating, but trying to call and even having a phone meeting if possible with their family physician, that's probably the first step.
So that's the first thing they should do, is call their doctor. And then what would happen from there? How do the doctors sort of interfere with it, or are there programs? What's the next step usually?
Yes. Typically, parents would want to go in and have a really outlined approach to their concerns with their doctor, because they need to advocate for their child getting to a program. And sometimes it helps to bring in the actual referral paperwork to the doctor so they can easily fill it out. But that would be the next step, is being referred to an eating disorder program, such as the one at McMaster. We see moderate to severe eating disorders. If the eating disorder is more mild, there are private therapists in the community or other support groups, such as at the Rock in Burlington. They see children who have body image concern and work on self-esteem. So there's various levels of intervention depending on the need of the child. There's also a lot of great internet resources that parents could access, including the National Initiative for Eating Disorders website and the Maudsley Parents website. It's maudsleyparents.org. And there's great information there about when to be worried, how to access help, etc.
Can you talk a little bit about the current program at McMaster? Just explain it and yeah.
Sure. So we have a fairly large program, although it never feels like enough. We still have a 1.5-year waiting list right now. We have inpatient care, we have a day hospital, and we have outpatient resources. So typically we'd start off wanting to do least invasive treatment. So that would generally mean outpatient, family-based treatment where the young person comes in with their parents. Right now, a lot of it is done virtually because of the pandemic, and it can work virtually or in person. And typically that's the treatment where parents are put in charge of renourishing their young person or interrupting eating disorder behaviors. Sometimes we work more one-on-one with the young person doing therapy. So that would be our outpatient. We do have a dietitian also involved in our program who can help with meal plans or helping parents know what some dense foods might be. And then we have our day hospital, which is more intensive, where kids come for the day but sleep at home. It's highly structured with 3 meals and 2 snacks provided in the program, as well as group therapy and school. And then we have our inpatient program, which is mainly for medical stabilization, but there is a strong mental health component with groups and educating kids and parents about skills that they can use, coping strategies, etc.
How many patients overall in the group?
Well, we have right now 8 beds. We had 6, and we recently received government funding to go up to 8 beds due to the extreme need that we were facing. We only have 4 day hospital positions, and we're desperately in need of more resources for that area. There's a long waiting list. And then for outpatient, we serve more than 200 outpatients. Again, long waiting list still though.
Can you talk about why it's a 1.5 year wait list?
Right, a great question. It used to be 6 months, and with the pandemic, we've seen this incredible rise in new cases of anorexia nervosa, as well as atypical anorexia nervosa and all other types of eating disorders. So we've experienced that rise in new referrals and the need for hospitalization, as a lot of the children are very sick on presentation as well.
Why do you think it's increased during the pandemic?
And that's part of our research question as well. With this new project, we hope to interview 70 stakeholders, which include young people, parents, clinicians, and administrators, asking them why are we seeing this rise in cases, to gain a better understanding. We have some theories about why it's happening, but we want to ask people in a more methodical way about it. Our theories include that the lockdowns and restrictions have impacted young people, creating anxiety and mood issues that then translate into eating problems, body image concern, and a search for how to make themselves feel better, which may be tied in with weight loss and body image.
Can you talk a little bit more about that? So what specifically about the lockdowns? Is it lack of being able to go see, social interactions, sports? What are all the factors that come with that?
Yeah, we know for adolescents that it's critical in their developmental phase to be out in the world with their friends. So this has really interrupted their development. And I think that social piece is really key. It's really that restriction and social interaction has resulted in these mood and anxiety and eating disorder problems. I think lack of access to their usual activities and sports that they would enjoy and they would gain confidence from and increase self-esteem, those things get taken away, and there's not that outlet for enjoyment, and that makes children and adolescents turn inward and think, oh, I've got to improve something about myself to feel better. And a lot of messages in social media say, if you lose weight, you'll feel better, people will like you more. So I think those messages have impacted young people. And there were messages that the pandemic created weight gain. So a lot of adolescents were afraid of that and started to exercise and restrict their intake.
What would you say to someone watching this who is currently struggling with an eating disorder? What are something you would say?
Yes. If they're a teenager or a child, I would encourage them to reach out to any adult that they find supportive in their life. It could be their parent, it could be a teacher. I know that's harder right now with online school, but even reaching out online to a supportive teacher, they can help find help for that young person. Even talking to a friend could be helpful. Maybe that friend has access to a supportive adult. But getting help is really important right now, because there shouldn't be any shame in that. We're all struggling through this pandemic, and I encourage young people to reach out and get some help. And if you're an adult, please look at the internet for support resources, go to your family doctor, seek help, because that is the best way to feel better and get better quickly. If we know that as eating disorders linger, that they're much harder to treat.
And just before we go here, can you talk about the increase in referrals? I'm not sure if we covered that fully this year.
Yes. Yeah. So pretty quickly after the pandemic was declared, I would say within 3 months or so, we noticed a large increase in referrals to our program. This included increased need for hospitalization, but also increased outpatient referrals, a doubling or tripling in the amount of young people needing hospitalization or getting referred. And now we know with new research that this is a common pattern across the country and across the world as well, that especially cases of anorexia nervosa and atypical anorexia nervosa, where there's weight loss, but someone still remains in a normal range for weight. They still can have medical complications and be admitted to hospital. So we're really noticing that group has increased in incidence.
Do you think when things start to open back up again, things get back to normal, you'll see a decrease, or do you think this is going to be a long-lasting issue?
Unfortunately, I think this is going to be a longer lasting issue. And even when we've had periods where the pandemic is a little more settled and things are open, we're still seeing large numbers of referrals. So I think the impact of the pandemic has been much greater on young people, and we're going to see the lasting impacts for quite some time.
Thank you so much for that. Is there anything else you want to talk about?
Just that we're very thankful to the government for funding this project, and we feel hopeful that if we can better understand what are the stressors and triggers, that we could help people better